Hello and welcome. This is Joe Valenzuela with Vista Mutual Insurance Services. And today we're going to talk about how you can compare Medicare plans from private insurance companies. So we're going to talk about Medicare supplements and Medicare Advantage and how you can compare your options. The first thing that you need to understand is just the basics of Medicare. So Medicare or original Medicare is Part A and Part B. That's what you're going to get from the federal government when you turn 65 or have a disability. Now that is going to cover, 80% of things, and it has some deductibles and coinsurance, which is why people get additional insurance on top of it. There's two ways to go when you're getting that additional insurance. One is with the Medicare Advantage program, and one is with the Medicare Supplement program and Part D. A little bit of the differences between those, Medigap or Medicare Supplement plans are designed to fill in the gaps of original Medicare, so they'll pay for the deductibles and coinsurance. Now, these plans usually have little out-of-pocket costs depending on the level of coverage that you pick, but are higher in cost than Medicare Advantage plans. They also do not cover prescription drugs, so a Part D plan, you'd have to get that separately if you get a Medicare supplement, and they do not usually cover additional benefits like dental, vision, and hearing, although there are some companies that are starting to do this now. So Medicare Advantage is a Medicare replacement. It takes over for your Medicare, and the private insurance company becomes your primary insurer. So the bills don't go to Medicare anymore, they go to the private insurance company. So that's really the basic difference. There's a lot more nuance to that, and we have videos that just break that down, so feel free to check those out. But that's just the basics to get you started with this video. Now, you also want to evaluate the types of plans offered. There are lots of different types of plans offered in the Medicare supplement and the Medicare Advantage world. Now, these plans are usually county specific or even sometimes zip code specific, so not all areas will have all plans. So you want to kind of look at things from a global perspective of what have I needed in the past, what do I need in the future? And of course, we don't 100% know that, and that's what insurance is. And then also how you view insurance. Are you the type of person that likes to pay one fee, even if that's a very high fee, and then just know that everything is covered and have a wide network available to you? Or are you someone that wants to conserve on costs and maybe pay as you go? So the first one would be Medicare Supplement. The second would be Medicare Advantage. Now, you want to examine all of the costs associated with each type of plan. There's your premium, what you have to pay on a monthly basis guaranteed. And with the Medicare supplement, you have to pay the supplement plan and the Part D plan. With a Medicare Advantage, again, it's usually going to be a lot lower per month, but you're going to have higher co-payments, and it's going to include your prescription drug coverage. But you're going to have co-payments for each service on a Medicare Advantage plan. You're going to have maximum out-of-pockets on a Medicare Advantage plan. That means an amount that you can't possibly go over in a calendar year. It's your protection or safety net or ceiling. You're going to have different medication co-payments, different possible pharmacies that you can see. So you want to evaluate each and every line of the cost of coverage so you're not surprised at all when you get a bill and you know exactly what you have to pay. The provider networks can be difficult. Now, if you're choosing a Medicare supplement plan, the provider network is all of Medicare. So any doctor that accepts Medicare nationwide, since Medicare is your primary insurance, will accept your Medicare supplement plan. There are some caveats to that in some areas that do a lot of concierge doctor services that are not accepting new patients for Medicare supplement, but you'll hardly run into this. It is very easy to get care, even in another state or another county, through another network with a Medicare supplement plan. With a Medicare Advantage plan, now usually these plans are going to be HMOs, which stand for Health Maintenance Organizations, and it means that you have to have a primary care physician. You're attached to a network of doctors and hospitals, and that primary care physician refers you out to your specialist. So to see your endocrinologist or any IST, you have to get a referral first. Not every time, but just the first time. And then after that, you can have ongoing, continuous appointments with your provider. So it's important to consider this especially if you're looking at a Medicare Advantage plan, because you may not know that you have doctors in multiple networks, and choosing just one network could have you lose access to other networks or other doctors. If you're just in one network, then these plans can work for you. Or there are Medicare Advantage PPOs that have in and out of network costs, so you can still see the provider that you want to see. It just may cost you more. Now, this is sometimes difficult to locate, and there are carrier websites where you can do this. Of course, you can always reach out to an agent. We as Medicare insurance agents are absolutely free for our clients. We never charge anything for an evaluation or consultation. We'll look at all the plans available for you, look up your doctors, all your medications, and ensure the plan is correct for you. Now, we want to check the star or quality ratings as well. This is easy to do on the Medicare.gov Plan Finder. This is available to all consumers. It even has a section where you can put your information in, and it'll pull what you currently have from the Medicare system. So you want to look at these star ratings. There is a rating that each plan gets from 1 to 5 every single year. And it's based on a lot of different metrics. So you can take it with a little bit of grain of salt, but it is a good or the only real evaluation tool for all of these plans. And if there's a low performing plan, a plan that's under 3 stars for a number of years, then that plan actually has to back out. So they want high quality plans out there. So they've implemented this star rating system. And that star rating system actually is directly tied to reimbursement for the carriers. So the higher stars they have, the more they get reimbursement from Medicare. So they're incentivized to be better. So you want to look at these, and a small grain of salt, but if plans are the exact same and one has a 4-star and one has a 3-star, I would choose the 4. You'll also want to take a very hard look at the additional benefits. With Medicare Advantage plans and some Medicare supplement plans, you're going to be privy to some extra benefits like dental, vision, hearing aid coverage, transportation, gym memberships, a bunch of slew of items. So you want to, first of all, determine if you're going to use these type of benefits, because they sound great, right? But if you're not going to use them, then you're not going to get much value out of them. If you're going to get a grocery card, but you don't want to go to the grocery store and use that grocery card, it's going to do nothing for you. If you're going to get a gym membership, but you don't ever go to the gym, it's really not going to do much for you. Things like dental and vision, though, most people will use these services throughout the year. So that's a good one to look at. You also want to try to gauge the customer service of these companies. And that can be hard to do before you're on the plan, of course. The one thing that you can do is reach out to an agent like myself, and we deal with these companies all the time on their customer service front end, as well as their broker support back end. So we have a good idea about how companies treat us. Now, obviously, that's anecdotal evidence, and anything you look up with this is going to be anecdotal. So if you go online, you can see a lot of reviews and things, but know that bad news always travels faster than good news. Most people aren't going to go online and rave about a good experience they've had, but a lot of people will talk about a bad one. So take those with a grain of salt, but it's good to do your research to see if there's a lot of complaints about a company's customer service. Maybe that's not something that you want to deal with. Now, we as an agency provide an additional layer of customer service through your agent. So we never really ask you to call customer service. We want you to contact us first, and usually we can resolve the issue faster at the local level. Now, we talked a little bit about the Medicare Plan Finder tool, and this is one of the better tools to evaluate your coverage. You can find it at Medicare.gov, and it's an online tool. You can put in your medications, you can put in your zip code, you can put in the pharmacy that you use, and it will show you the lowest costing plans and their available benefits. Now, it doesn't have all the information. It's a little bit summarized, if you will. And all the information is there. It's just a little bit hard to access. But I would suggest going on there, just searching around. This will give you a good idea of what's available for your county. You can also use the State Health Insurance Assistance Program, or SHIP program, and HICAP, which is the Health Insurance Advocacy and Counseling Program. Now, these systems are volunteer, so keep that in mind. There's limited training, and they're volunteering their time. So you may not get somebody that is an expert in every way on all how to do these things, but they can really kind of push you in the right direction and show you what's available as well. They cannot enroll you into a plan, nor can they service you afterwards. So it's good to start there and then go on to an agent that costs you nothing, lives and breathes this stuff, and can actually enroll you and service you afterwards. You can always look at reviews and testimonials as well, but just like the customer service thing, you're going to find a lot of stuff online. Some of it's going to be true, some of it's not, and you're going to find way more negative stuff than you will positive. So keep that in mind when you're looking at these things. If you just looked at all the reviews, you'd think every insurance company sucks. And that's not necessarily the case. We're just viewing anecdotal evidence from individuals that have had a bad experience. And this stuff can be complicated. So people do have bad experiences. Another way too is to utilize us, Vista Mutual Insurance Services. Now, we provide a free service that can help you evaluate your coverage. We have tools that are not available to the public that we can look up all your doctors, all of your medications, all the plans that are available in your area, and give you a breakdown of the yearly cost for each one. We can show you the nuances between the plans, since we live and breathe this stuff, things that you might miss on your own, and all for no cost. So definitely reach out to us and we can help evaluate your coverage. Another way is to consult with your healthcare provider. A lot of them will have experiences with different healthcare plans. And you can talk to a number of different people. You can talk to your doctor, your specialist, you can talk to the front end staff, the nurse practitioners, and just kind of gauge what most people have in that office or what they like billing. And this will just give you another feather in your cap to pick the right plan for you. Now, you want to evaluate your individual needs and preferences. And this can sometimes be difficult since Medicare insurance is so confusing, but sitting down with an agent and having an hour conversation and really getting down into the nuances of all these things, and then realizing, okay, I do kind of want to go Medicare Advantage or Medicare Supplement. And then having all the plans shown to you that agent represents. We represent all plans that will allow us to per county. It's really going to give you a great idea of what's out there for you. Not only that, but you'll be able to ask questions. When you're reading this stuff yourself online, it's great that all the information is there, but sometimes you don't understand something and you can't really ask a question. So by sitting down with one of us, you can ask all those questions, really get a great understanding of what you're doing and why you're doing it, and make a good decision. And after you've made that decision, it's important to review that decision on an annual basis. Medicare insurance plans change. So do your needs, and maybe even your financial situation or your location. So if that all changes, then it's important to evaluate your plan. And even if nothing changes, or you think nothing's changed, there's always small things that change each year. And that's why we reach out to all of our clients to set up an annual review. We tell them what their plan has changed into and about any other options that may suit their needs, just to make sure that they're always in the right plan for them. This is just a couple of things that you can use to evaluate and compare your Medicare insurance plans. And I hope that these videos give you guys a lot of insight and tools and tips and tricks to make your Medicare insurance journey easier. Below, if you comment or ask questions, we will answer them for you. And please like, subscribe, and engage with our content so we can continue to bring you this great information. From Vista Mutual Insurance Services, I'm Joe Valenzuela. Thank you very much. Until next time.